my Be Health Empowered family. Welcome, welcome, welcome back to another week of Excuse Me, Doctor. My name is Dr. Melissa Clark. Please call me Dr. Mel. I am delighted to be back here with you this week, doing what we do each and every week, have the right information to make wise decisions about your health, and not just your health, but the health of your family, your loved ones, and even your community. So thank you for tuning in to Excuse Me, Doctor on any of the platforms that you're checking us out on. We love you for it. And if you please go ahead and hit that red subscribe button if you're checking us out on YouTube, or the like button if you're checking us out on Facebook, we really, really appreciate that. And so, we are going to get into it with making this an incredible week filled with all the health and wellness tips that you would ever want. So I have to do that with my crew, and that includes Mr. Wayne Bruce and Miss Lila Mays. Come on in, y'all.
Hey, hey.
Hey, how y'all doing?
I thought we fired that intern last week.
Man, this intern keep cutting off my mic. I need to say something, Dr. Mel. Like, we need a new intern.
I thought we got rid of them.
Get it off your chest. Go ahead.
I mean,
Complain
I got
about
on pink.
intern.
I can't do too much getting it on my chest because I'm here for the cause.
All right. Well,
How y'all doing?
We're glad you're here for the cause. We're glad we can hear you. We're glad because y'all are bringing a word from the streets. So we got to be able to hear you.
We up in these streets. We are.
We are.
Yeah. So what are we talking about today?
Well, listen, last week we were talking in the recap about how it's October and it's Breast Cancer Awareness Month. And today's show is devoted to being health empowered when it comes to managing breast cancer.
All right.
Yeah. And, just from last week, I had no idea about the fact that cutting out alcohol and eating a plant-based diet could cut your risk for breast cancer. How y'all coming with that?
Y'all. I mean, men unfortunately get breast cancer too. So this is not just about women and the health changes that we're making. We all are in this together. We all have to make these changes.
Indeed. So y'all stay tuned. Yeah, because we're going to hear from an amazing physician who has dedicated her career to empowering Black women in diagnosis and treatment of breast cancer.
Yeah, and we also have a very special guest, one of the most talented. She's your favorite singer's favorite singer. You know what I'm saying? Like, she is incredible and talented vocalist, and she will share her empowering journey of her breast cancer journey. And she shared it already on her social media platforms, but we get to hear it tonight in person. She's one of my favorites.
Yes, absolutely. So we are honored to have them both. This is going to be a great show. Y'all stay tuned. And not only stay tuned, go ahead on right now and share it. And share it again and share it again and again with everybody that you know who needs this information. So we're going to pause for a half a second while you do that. Share.
Share.
And always remember, we're here for you. So we want to make sure that you're putting your questions in the chat and putting your comments in the chat because, we're going to get to it as we go along. So, get those fingers a type and get them all ready.
But before we do all that, we got to go to the week that was in health and wellness.
Yeah.
Here we go.
Oh, what happened to our sound effect? Okay.
Hold on. Where's our sound effect?
Where's the intern? You fired her or him?
That intern is terrible.
It's terrible.
They left us with a. They left us.
Oh Lord!
All right. The week it was.
There we go. All right.
COVID, not one and done, huh?
It is not. So what we're seeing now, we have the benefit of 4 years of looking back at information about COVID, data about COVID. And we're seeing, unfortunately, that having had a COVID infection increases the risk of heart attacks, strokes, and other major cardiovascular events for up to 3 years after the initial infection.
3 years? 3 years?
3 years. And this is based on medical records from over 250,000 people. So this is not like just a little study off in the corner. They looked at people who had COVID in 2020, and they saw that they had 2 times the risk of heart-related events compared to those who didn't contract COVID. And if you were hospitalized with COVID, that risk tripled actually, as opposed to doubled.
Good.
Wow.
Oh
So
my
what
goodness.
can we do? Because just about everyone has had COVID at this point.
That is true. And if you've had COVID, I mean, I've had it twice, unfortunately.
Mhm.
So if you were hospitalized for it, I would say be extra vigilant about your heart health, including managing your blood pressure closely, managing your blood sugar, trying to lose 20% of your body weight if you're overweight, managing your cholesterol, eating a diet high in fiber, moving 30 minutes a day, 5 days a week, all those things that we know we need to be doing.
Mhm.
Right.
In addition, I would say also talk to your doctor about taking low dose aspirin. Don't just start it on your own,
Okay.
because low dose aspirin does, those people who are on it, it appeared to reduce the risk of heart attacks or strokes in people who were hospitalized for COVID. So again, don't just start it, talk to your doctor about it, because some people are allergic, some people can have side effects. So it's important to do that move in conjunction with your doctor.
Okay. All right. So y'all heard Dr. Mill said talk to your doctor first before you just start taking aspirin because it has its own side effects possibly. But what about the vaccine? Does that protect?
So this particular study that I'm talking about in Circulation, it didn't examine how COVID vaccination impacts the risks, the risks that I talked about. But most experts agree that vaccines, because they reduce the likelihood of a severe infection, probably also lower the risk.
Okay.
Okay. There we go.
Not a one
N-
and done.
Not one and done. So that brings us to number 2. And I'm always good for number 2. Anyway, look, I just want to let everybody know I'm an athlete, and but I'm only an athlete on the weekends. So I need all my weekend warriors to unite. How about that, Dr. Will?
Well, it does. It turns out that in the Heart Journal Circulation, it's so that people who exercise only on the weekend, so the so-called weekend warriors, have just about the same benefits from exercise compared to people who do it throughout the week. And compared, together, both of those groups, both the weekend warriors and the weekday warriors, did much better than those people who were inactive.
So does inactive mean like the couch potato?
No,
You
actually, what it actually means is if you get less than 150 minutes per week of moderate to vigorous physical activity, like brisk walking or cycling, then you're considered inactive.
Wow, that's awesome. So if my life is too hectic during the week, I can make it up on the weekends as long as I go hard.
Go hard. Yep. So those weekend warriors had a lower risk of developing more than 250 diseases, and especially high blood pressure and diabetes. So the bottom line is, no matter what you choose your workout pattern to be, what's the most important thing is to stay active and basically make sure you're getting it in.
Come on
Okay.
now.
All
Come
right,
on,
weekend
weekend
warriors.
warriors.
Unite.
Come on.
Well,
Unite.
I'm trying to close my rings every day, but y'all go get
There you
it,
go.
weekend warriors. Go get it.
Everybody has their thing.
um, listen, I had to take number 3 because this is a big one for me. They say Joe don't go with everything. Let's tell the people about this, Dr. Bell, because I takes everything with my Joe. So let's get into it.
So by Joe, we talk about our morning Joe, our coffee, and coffee is a drug. Okay, let's be clear.
Be
And
clear.
let's be clear. And it can take the time, it can affect the time that it takes food to make it through your digestive system. And therefore it can change how fast some of the medications that you might be taking are absorbed if you're taking it with your coffee.
Okay.
So, Dr. Mel,
Yes.
maybe I shouldn't be chasing my coffee with my medication. Is that what you're trying to tell me? Because I do every morning. I usually take my medication with my coffee, but let's tell the people what they should do.
Well, it depends what kind of medication you're taking, right? It doesn't apply to all medication, but there are certain classes of medications that you should be not taking with coffee. So I'm going to run them down. Number one, thyroid medicine. If you're taking medicine because you have a low thyroid, so levothyroxine is the name of that drug, you probably don't want to take it with your coffee because it can affect the absorption of it.
Okay.
The next class are Alzheimer's medicines. So I'm going to say the names: donazepam, ribostigmine, galantamine. Okay. Those should not be taken with coffee because the caffeine in the coffee tightens up so those medicines work by getting into your brain, and there's a barrier between the bloodstream and your brain called the blood-brain barrier, and it can cause those blood vessels to constrict, which is what caffeine does, and therefore it can lower how much of that medicine gets to where it's supposed to get.
Okay.
The third out of four are osteoporosis medications. So that's residronate or abandronate. So that osteoporosis is a disease where as you age, your bones get thinner. And also certain chemotherapy medicines can cause that too. So if you're taking those medicines, again, don't take it with the coffee because it makes those drugs less effective. And finally, last but not least, medications for depression. So amitriptyline, imipramine, and others. You can check with whoever's prescribing your antidepressant medicine. Oh, fluvoxamine is another one. If you're drinking large amounts of coffee, that can reduce the amount that the medicine is absorbed by your body. So the four things: thyroid, Alzheimer's, osteoporosis medicines, and antidepressants. Talk to your doctor. Check if coffee, or your pharmacist. Pharmacists are great sources of information on this. Check with them to see if the medicine you're taking might be interacting with your morning, afternoon, or for some people, nighttime dose of coffee.
So Dr. Mel, is it the caffeine in the coffee?
Yes, it is the caffeine in the coffee. It is, like I said, it's a drug.
So it could be tea also. Like
that is true. Although tea has a little less caffeine. Probably green tea is an exception. But yes, I would also be careful with tea as well. Caffeinated tea.
And yeah, if you are taking care, if you're a caretaker for an Alzheimer's patient,
yes,
to do that, because it's not like it's real.
Like they would key in on that. Exactly.
Yeah, because you know it's not like the patient is going to remember not to do that.
Right. Great point. Absolutely.
That's what I'm
thank
here
you
for.
all. Yeah, that is, and you did what you came to do. I appreciate that. So thank you all. We're gonna see you back in a little bit, and we're gonna go into our show for tonight, which is a super important topic in recognition of October, which is Breast Cancer Awareness Month. So we know that in the United States, a woman's lifetime risk of breast cancer is actually 1 in 8. And for women under 60, unfortunately, it's one of the more deadly cancers, actually the most deadly cancer. Black women, we know, have a 31% mortality rate or rate of dying from breast cancer. It's the highest of any U.S. racial or ethnic group. And even though deaths from breast cancer are going down overall, we still have to keep an eye on it because there's been a rise in the incidence of breast cancer in African American women. So today, we're going to speak to those women. This show is especially for those women who've had a breast cancer diagnosis, or just anybody in the age group who might be susceptible to getting breast cancer. And that also includes men as well. So what do you do? Where do you go? What should you know when it comes to a breast cancer diagnosis? We have two incredible guests. Our first guest is she's a board-certified general surgeon specializing in breast cancer surgery. She's ranked as one of the top doctors in the Washington, D.C. area, and she's a powerhouse when it comes to helping Black women getting screened for breast cancer and knowing their treatment options for breast cancer. So welcome, Dr. Hampton, thank you so much for joining us. And our next guest is our second guest is vocalist Cy Smith, often called the hardest working woman in underground soul. She is a dynamic singer, songwriter, actress, producer, and she has an incredible vocal range that she's used to sing with so many of our favorite artists, from Whitney Houston to Shaka Khan to Usher, and for jazz fans, which is where I saw her, trumpeter Chris Botti. So welcome, Cy Smith. Thanks so much for joining us.
Thank you so much for having me. I really appreciate being here.
Absolutely. So we're going to start with you, Dr. Hampton. What is breast cancer and how does it develop in the body?
So, breast cancer or cancer cells in general are cells that have just gone awry. They have taken a different path from our normal cells. You know, our cells every day take hits, they get damaged, and our normal cells can repair themselves, whereas cancer cells cannot. And so, one of the things that we're still trying to figure out is what makes those cells kind of turn that wrong corner, and that's something that we're still trying to discover.
So what's the difference between, we hear the terms benign and malignant. What's the difference between those?
So when we say benign, we essentially mean something that's non-cancerous. So there are a lot of benign, non-cancerous lumps. A tumor is essentially just a lump or a mass of cells that can occur in the breast tissue. And then malignant means anything that is cancer. So whether that's an invasive cancer, there's some other cancers, something called a phylloides tumor. So all those we lump under the heading of malignant.
Got it. So important to sort of set the table and understand the terms, because then I'm going to ask you, Cy, tell us, how did you find out that you had breast cancer?
Oh, my discovery of this was through a routine mammogram that I had back in April. I got a notice on my app, my healthcare app, saying, "Hey, it's time to go get your mammogram." So I called, scheduled the mammogram, went in, and it was sort of it was a little bit convoluted the way it happened. The radiologist, God bless her heart, she's human. So she sort of had a reaction to something she saw on the screen, and I caught it, and it was a fleeting moment, but I saw it. And she said to me, I was like, "Is everything okay?" And she was just like, "Oh no, everything's fine. We just gotta, blah, 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 blah," but I think radiologists aren't really allowed to like give you the diagnosis. It has to come from your doctor. So even though I saw that reaction and I felt like a kick in my gut, like, "Oh my God, I think I have breast cancer," I didn't
Yeah.
actually get the confirmation from my doctor until 2 months later. And that was because
2
of,
months?
yes, because I had to they called me in to get another mammogram. And as you said earlier, I'm the hardest working woman in the show business. So I was on tour and
Yeah.
and it took a month to get scheduled for a biopsy. And it wasn't until after the biopsy that I got my actual, diagnosis from the doctor. So the mammogram was in April. The biopsy, the second mammogram was the end of April. The biopsy was at the end of May. The diagnosis came June 5th.
Wow. So we're talking about very recent. And just to underscore for everybody, we're talking about 2024 this year. And
Yes.
yes, and I think it underscores too. I mean, we're out here living our lives, right? It's inconvenient, right, to get this kind of diagnosis, and it's hard sometimes to make sure that you know we have the time and have the space to follow up on the mammogram or follow up on the ultrasound, etc. So I'm glad that you did and you were able to. um so, Dr. Hampton, are Black women more likely to get breast cancer?
So we actually get breast cancer at a lower rate when compared to our white counterparts. However, when we look at the mortality rates, we die at a 40% greater rate when compared to all other ethnicities. And one of the challenges is that we tend to get breast cancer at younger ages. So under the age of 45 and even under the age of 40, which is a problem because those women aren't at an age where we're starting to get regular yearly mammograms.
Yeah. So thank you for highlighting that the age is 40. What are some of the things that we should be advocating for as Black women in terms of, if we have a concern, starting to get screened earlier?
Yeah, so I think it's important that if any woman, no matter her age, has any type of issue, breast pain, a lump that doesn't go away, nipple discharge that seems out of the ordinary, that it is important to go and talk to your doctor, and at least see if they will get some type of exam, an ultrasound or even a mammogram. If you find that that's not happening, then I recommend going to a breast specialist to have a conversation, get evaluated, and then typically the breast specialist can send you for that imaging.
So are you an advocate of breast self-exams? Because I know that's been very controversial in terms of the national guidelines, but so many people anecdotally say, my partner felt a lump or I felt a lump, and that's what made me go in to get checked.
Yeah, I still believe in breast self exam. I think it is important for women and men to know what is normal for them. And so I think the way we taught breast self exam was a little scary. So I look at it as just learn your normal. Every month,
Mm.
do your own self check and just learn your own lumpy, bumpy characteristics so that if something feels different, it's going to stick out to you. And then you're going to want to let your doctor know about that.
Sure, sure. So Sai, I want to continue, you know, traveling with you on this journey. After you heard the diagnosis, was it a smooth journey, or would you say that there have been bumps around along the way? It sounds like even getting diagnosed, there were a couple of bumps in there, but how would you characterize how your treatment has been and, how the communication has been with the doctors and the specialists?
I would say that my journey was very much likened to my journey and work as an entertainer. We have a saying in entertainment when we're on a set, for instance, hurry up and wait, where it's
Mm,
like you get on set and they got to get you right to makeup, they got to get you right to this, but then you just sit around and wait all day until it's time for your camera shot. That's how it
mhm,
felt with this breast cancer journey for me. I had to like hurry up and get back in for this mammogram, but then I had to wait a long time before I could get in for my biopsy for a couple of reasons. It wasn't just that they didn't have space. It was that by the time they did have an appointment for me, I had to be on the road. So then I
mm,
had to wait, until I came back, um, which made it really strange for me because I was on the road. I was in Europe. Imagine singing, for 2,000 people every night,
yeah,
feeling good when you actually feel like you probably have a full-blown carcinoma in your breast,
yeah,
that you
yeah.
can't do anything about. But the show must go on. So it wasn't until I really could get in after that biopsy and finally got assigned a breast specialist or a breast surgeon, that I felt like finally I can talk to someone and figure out when the disruption to my life is going to take place.
Mhm,
After
mhm,
I got in with that person, and she is a wonderful breast surgeon. I was so happy that she is a Black woman. Um,
mhm.
I was able to really talk frankly with her and discuss my concerns and all my scheduling conflicts and what is this going to mean for my life and what kind of treatment am I going to have. She really helped me because she was able to talk to me like a real person, and that made the journey much smoother from that point on.
Yeah.
Yeah.
How did you navigate though that hurry up and wait thing when you were on tour and you didn't have how from a mental health and emotional health standpoint, how did you get through that?
It was really it wasn't difficult in the moment. What I am finding is that I didn't process what was going on, and I am just now beginning to process.
Mhm.
So it was like I was just working and just I had to just keep going, keep going, keep
Yeah.
going.
Yeah.
It wasn't until after my surgery and after my recovery, which is really like right now as we're talking,
Mhm.
that I realized I didn't process what was happening because I never really had time to process it. So I'm sort of retroactively processing what happened to me. You know,
Right, right.
um, I had a therapist assigned to me um, once I got my breast specialist, which was perfect. But
Mhm.
I only had time. I only had like 2 weeks, between the time that I got my surgery date and my surgery. I only had 2 weeks, um, so I only had like two times to meet with her. So
Mhm.
I plan to like just get back with her so that I can start really breaking down what I went through and discussing it in a way that is productive, because I think what the way I went through my journey, I didn't have time to do it. I didn't have time to
Sure,
process it. I was just living. I was just going
sure.
like that bunny rabbit, just keep
Right.
going, going. You know?
Right, and I think, that's one of the ways that we sort of protect ourselves and take in information and process it at the speed that we can, especially with something so life altering. Um, and, I'm gonna go back to Dr. Hampton because I wanna kinda walk through, what are the stages of being diagnosed. And this, we emphasize sort of what the mortality and the experiences of Black women because there's a disparity. But I want everybody to be clear, this is for everybody, especially, the advocacy part and understanding the various parts of the journey. So the next question, Dr. Hampton, is for you. What happens after a lump or abnormality is found in screening? Can you kind of walk through those steps for me? Because I know that Sai has been through them, and I want everybody to understand sort of what she went through from the uh, sequential standpoint.
Mhm. Yeah, so typically a woman goes in, gets her mammogram. If she doesn't have symptoms, it's what's known as a screening mammogram. If she already, feels something, then we're going to do a diagnostic mammogram. Depending on the result of that, then we may send the patient to get an ultrasound, which is just going to look at the breast a little bit differently. If the radiologist feels like it's something suspicious, then they're going to proceed with doing a biopsy. The good thing is the way we do the biopsies now, they can be done right in the office setting, right at the radiology center or in a surgeon's office. It really only takes about 15 to 20 minutes to do the procedure, which is done with local anesthesia. And we can get the results back within 24 to 48 hours.
So when you do that, I know Sai mentioned that you were assigned a breast cancer specialist. If no one sort of assigns you that, how do you know what are the best hospitals or the best doctors to go to in general? What's the process for figuring that out?
Yeah, it can be a little complicated depending on where the diagnosis is made. They may have what are called nurse navigators that can really help walk the patient through the process of finding the right doctor. I think it's important to, talk to friends and family and get, personal recommendations. You can go to websites. There's the Society of Breast Surgeons. There's the Society of Clinical Oncologists, the Society of Radiation Oncologists, where you can look there and try to find someone in your area. And what I tell patients is, go meet with someone, and see how you feel. If it just doesn't feel like a good fit, then go ahead and get a second opinion. Sometimes you just need to hear things in a different way, or maybe it's just not a good vibe with that particular doctor or provider. And I think it's okay to take that time and get a second opinion.
Absolutely. And it sounds like Sai, you did end up with someone who you can have great conversations with. And so I'm wondering, in all the process with the various specialists and your primary care doctor, were you, uh, we know that there are different kinds of cancer. So were you told what kind of cancer you have and why that makes a difference in the treatment that you ultimately received?
Yes. So the funny thing is, when I did that second mammogram, um, the app for my healthcare system automatically populates with whatever information they get, you know. So I actually saw the diagnosis in the app before my primary care physician called me to tell me. And that was a trip, because here I am reading, you know, ductal carcinoma in situ, necrosis, blah blah blah. Well, what does all this mean? Do I have cancer?
Mm,
Like, you know, did somebody
mm,
tell me? It was
yeah.
really frustrating. And then when my PCP finally did call me, you know, I already knew. He called maybe the evening after it populated in my app. I don't think the doctors necessarily know how quickly your apps populate. but
I think you're right.
but it's scary. It's a scary thing to
Yeah.
read these diagnoses without your physician talking you through them. So he called and I missed the call. So we didn't actually talk until 2 days after the app populated.
Mm,
Um, and then, but when I did finally, and you know, when he called, he just told me in a very sort of direct way. Um, and, you know, there was, and he was like, you know, I'm going to refer you to da 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 da. And, you know, it was all just sort of formal. Um,
mhm.
it wasn't until I actually met with my breast specialist that I really understood and was told in terms that I could understand what was happening, you know,
Yeah.
what DCIS means. And she drew it out on a piece of paper, and, you know, and we really, it made sense. It was so much better than reading words on the app, you know, like
Yeah.
necrosis is a scary thing to see, because then you're like, is
Yeah.
something dead in my body? What does that mean? You
Yeah.
know?
Yeah.
Um, so yeah, I was really happy to finally speak with somebody who could talk to me like a human and
Sure.
explain to
Yeah, I
me
can
what, you know,
just comment.
uh,
I think on the physician end, it's hard for us because sometimes the patients do get the results before we've even had a chance to open it. It automatically sends it to the
Mhm.
patient. And, we want to be able to explain it because it's a lot of gibbly goop that you see on these of words that you don't know what they mean. And then you're anxious and you're waiting, for your appointment or for this phone call. It'd
or
be
you're
great for us
on
to find a better
WebMD
way.
looking stuff up.
Yeah.
Dr. Google.
Dr.
But
Google.
yeah, and it's a double-edged sword, right? Because, there are regulations that say patients have to have access to their information, and actually you have the right to get your medical records sent to you, but it's been a trade-off, just as Dr.
Yeah.
Hampton is saying. It's like normally that's what your doctor is for, to sort of walk you through it and give it context. And when you don't see it out of context, it can be extremely scary. So, yeah, I'm sorry that that happened, and unfortunately, I know it's probably going to happen with a lot more other patients as well.
Yeah.
Um, so, Dr. Hampton, why is it important to know what type what type of diagnosis you have when it comes to breast cancer, and how does that play into knowing whether you need surgery or radiation? Can you walk us through that a little bit?
Yeah, so it's really important to know the particular type of cancer. Is it in the ducts? Is it in the lobules? Is it an invasive breast cancer, or is it like size, a non-invasive breast cancer? We also want to know the hormone status. Are these tumors that like our hormones, or do they not? All of those factors help us to come up with a treatment plan, and it's very individualized. And thank goodness, because, 20, 30 years ago, everybody got the same treatment. But
Mm.
now, because we have, so much more at our fingertips, the surgeries are better. There are a lot more options. Radiation, there are a lot more options and even less radiation. And even the chemotherapy medications are a lot less. And we realize is that we really want to treat everyone, but we want women to continue living full lives during and after treatment.
And I like that you highlighted that treatment is really highly customized. Can you talk a little bit about what your organization does and the role that it plays in helping ensure that women get a timely diagnosis if they do indeed have breast cancer?
Yeah, so I have a foundation, Breast Care for Washington, and we are a mammography screening facility. located in Ward 8 of Washington, D.C. And our whole goal is really to provide access to top of the line screening, which is a 3D mammogram, and any other imaging and doing biopsies. That's just our small part to try and help to, curtail the disparities that we see, especially, in Ward 8 in Washington, D.C., which has one of the higher mortality rates actually in the country.
And the lowest amount of resources. Fewer grocery stores that have fresh produce, harder to get transportation to your doctor's office, not a lot of jobs in that area. So, yeah, we really applaud the fact that you're extending access to people who might find it difficult to access care. Um, so I'm going to switch gears a little bit. And, you have a hectic lifestyle. What are some of the changes, if any? And I know you're still kind of going through this and sort of reflecting on it, but what are some of the lifestyle changes, if any, that you have made or you're thinking about making in light of your diagnosis?
Here's the thing, doctor. I was pretty healthy. I had a pretty healthy lifestyle to begin with.
Mhm.
I run 3 miles every day, or between
Wow.
3 and 4 miles a day. I'm not vegan, but I'm vegetarian. I might eat some fish sometimes. I don't drink. I don't smoke. So I was already pretty healthy. If anything, the couple of weeks before, no, I think the day of my surgery, I had to stop drinking coffee, and that lasted for like 2 weeks, and that was so hard for me. So your
Yeah.
segment on Joe earlier, Joe don't go with everything, that made me laugh because I definitely had a moment.
Uh-huh.
um, but so, and even before the surgery, I was on a running streak. I was up to 341 days of running in a row,
Wow. Wow.
um, up into and including the day of my surgery. I ran. That's something that I do not just for the physical fitness of it, but running is a meditation for me. Um,
Mm. Mhm.
so I was definitely afraid, when the surgery happened and stuff, because I was like, oh my god, I gotta stop running. Like that's such a big part of my mental health
Yeah.
life, right?
Yeah.
uh,
Yeah.
and so I talked to the doctor about it, and she was like, you're going to need some time to recover, but you'll probably be able to run sooner than you think. When I came home from surgery, I couldn't run, obviously. I still had drains and all that kind of stuff. But I did some indoor walking routines, and that helped me kind of keep my regimen going. Um, and then probably 12 days after I got my drains removed, which was like 10
Mhm.
days after the surgery, I think I started running again like 12 days after I got out of the hospital. Um,
Wow, look at you.
yeah, and that's been a big part of my recovery. Um,
Sure.
Something else that I did very intentionally before the surgeries, was I wanted to make sure that joy was not so far in my rear view that I had to reach far to get it. So I did
Mhm.
things to just be happy. I went dancing. I went, my
Wow.
husband and I had a vacation planned. We went to Greece. Um,
Okay.
I went to hear music. I went to the park. I went to botanical gardens. Like I just did things to make myself feel happy in the couple of weeks leading up to my surgery, and I call it pre-covery.
I
Um,
love that.
I do
because I
too.
wanted to be sure that after my surgery, I wasn't so down in the dumps that I didn't remember what joy felt like.
Mhm. Oh, that is such beautiful I mean,
Love it.
that is just a beautiful testimony, right?
Thank you.
And, you know, just approaching life like that in general, but especially in light of the fact that you knew you were about to undergo surgery, I think is just even more powerful. And, I'm struck by the fact that you said that you were in great health. I have a close friend who had a very similar story to you. Great shape, ran every day, did exercises. Um, I can't say that I can't say that she was a vegetarian. I can't say that at all.
That's okay.
But she was very physically fit. So for Dr. Hampton, what do you tell the patient or the woman or man who, ends up with a breast cancer diagnosis despite, doing all the right things?
Yeah, so the two biggest risk factors for breast cancer are being a woman and having breasts. It's two biggest risk factors. Um, uh, so I think it's again just being aware, not only aware that you're a woman and have breasts, but being self-aware, checking yourself out, making sure that we get on the right schedule and getting our mammograms in a timely manner. And it's tough because we're all busy. We're working women. I myself have come off schedule with my mammograms as well, so I get it.
Yeah, definitely. And I think, there are even though those lifestyle factors are important, there are also genetic predispositions, there are also environmental exposures. So, there's only but so much we can do sometimes. And I think you have set yourself up for a very smooth recovery and hopefully never having a recurrence. So I think your story is incredibly inspirational. So thank you for sharing it. And I can't believe that it's that time. I know that there are probably some comments, questions in the chat. Lila and Wayne, what are y'all seeing out there in the internet's land?
In cyberspace. Well,
Yeah.
oh, that's sorry. I didn't mean to shout out your handle, but um, I have a question. This is a Lila question. Shout out to my mom who's watching, who is actually a breast cancer survivor. Hi, mommy. Um,
Hi, Mama Lila.
hi, Mama Paige. Um, After a mammogram, I had one. I get my routine screenings, doctor, and my doctor came back and said, negative, but here's your calculation for lifetime risk. And what we haven't discussed is what is that calculation? Can you break that down for us?
Yeah, so there are a lot of different types of calculations. There's something called the Gale model. There's something called the Klaus model. There's something called the Tarek model. And what we're trying to do is gather information about the patient, her family history, things about her weight, her height. Has she been on birth control? Has she been on other hormonal medications? Has she had biopsies? And they put it into this algorithm and it spits out a number. And so anything over 20% lifetime risk means that you should get screened and followed very closely, probably be followed in a high risk program with a breast team, and not only getting mammograms, but it may even include breast MRI as part of the screening.
MRI. Exactly, I was going to say. So, in full transparency, I've had all the things. I've had to have a couple of biopsies. My mom is a survivor, and so it did. I was like, "What is this based on?" And he and I haven't had a real conversation, but that was super helpful. Just what you said. There are so many things that factor into what our risks are. When you have some questions, I have some questions. If you don't,
Yeah, I have some questions. So this is from our chat. We got Yvonne wants to know how long is a general recovery once you go through a episode or just get the diagnosis.
You should take this.
Oh, go ahead, Sai.
I was going to say, so I keep saying surgery, but to be specific, I had a left side mastectomy and reconstruction. My reconstruction was built from tissue from my abdomen. I didn't get an implant. I used tissue from my abdomen. So I have one scar going all the way across my waist, and then I have the scar under my breast from where they removed my left breast. Mm-hmm. Wow. I think the doctor told me, 6 weeks is usually what it takes. I told her I'm gonna give you 3.5 because I got a show in London, because that's what I had, you know.
Uh-huh.
So I took 3.5 weeks to recover, but I think on average and all of this really depends on the patient, I'm sure, and I'm sure both doctors will chime into this, but it really depends on the patient and what their health is going in and, you know, coming out of it. I was already super healthy. Like I said, I started running 12 days after I got discharged.
Wow.
So my recovery is a little bit different.
And you had your pre-recovery routine too.
Right, I
Yeah.
had my
Come on now.
pre-recovery routine. Yeah. My pre-covery.
Recovery.
Yes, I think it can depend. It depends on the type of surgery that you have. Depends on, you know, do you have drains? Do you not have drains? So all those things really play into recovery. But I think, you know, Sai is just a great example of, you know, if you get yourself healthy before you have your surgery or go into treatment, you know, you're just going to recover a lot faster. So bravo. I love it.
Mhm.
So I would like to step in here and say to a couple things. One, you know, we grew up, our friends are our family, and our friends throughout school have been you know, our family. I want to shout out my good friend who's watching tonight, Sandra Hawkins Beard. She was on the show last year telling her story as a breast cancer survivor. Also, and I just want to say it's personal to me because I lost my sister. I lost a sister to breast cancer. And you know, some people every year would see me at this time have pink strings on my guitar. I am in the music industry. I still do music and everything. And and the reason we have Sai on is because you know, she's a friend as well as a musician. And like your favorite singer, I said that in all honesty, that she's incredible. But one of the things that absolutely, and I've been following her journey. Now, I'm not running 4 or 5 miles a day. I'm watching Sai every day on her Instagram. And one of the things where she said, it was either on one of the social media platforms, she actually showed a picture, and I thought that was so brave of her surgery and her scars from that. And you know, our scars make us who we are, and your scars make are you're going to you have done great things by showing people your scars, because people go through that every day and are ashamed of it, and you bringing that to light is amazing. And I want to tell you that as your friend, as your brother, and just as a fan, because I am
Yeah.
all right.
And
Thank
we
you so
thank
much.
you.
So lie.
I really wanted to share that, you know, share my journey, my scars and everything, because I wanted people to see, even though it's scary, or it can be scary, that you still come out of it okay, you know, and that everything is going to be okay. This is just what it looks like temporarily. I look like a barrel. You know, everything was swollen, and the sutures and the drains, and it just looks really scary. But I wanted people to see it. It's okay. Everything's gonna be okay. This is just what you go through to get to the okay part. You know?
Get to the other side. Yes.
Yeah.
Absolutely.
Thank you.
I have to say, so we're gonna give Sai her flowers while she's on the show.
Yes, absolutely.
Because the young woman that you are seeing here, her energy, the way she speaks, the way she sounds, that this is who Sai Smith is. And so I get to honor that lovely woman that you show up as all the time, Sai.
Thank you.
All right, y'all got me crying over here now.
So I'm the only one trying to stay dry-eyed here, but you know they welling up.
Right.
They are welling up. I don't want to make light. I have Janet Curtis in the chat says, I had my left breast mastectomy and reconstructive surgery with an implant. How long can the implant stay in? It's been 6 years. Shout
Great
out
question.
to you, Janet, also.
Yes, absolutely. And that one's for you, Dr. Hampton.
Yeah, so typically implants last about 10 years, give or take. So I think it's important to go back and, just meet with your plastic surgeon about year 8 or 9, just for a checkup, see what they think, and get their recommendation on if it's okay to stay in for a little bit longer, or if you have to think about replacing it.
Okay, there
All
you
right.
are, Janet.
All right, doctors. How can Black women find out about clinical trials around breast cancer, Dr. Hampton?
So there's a easy website, clinicaltrials.gov, and that's run by the NIH. And I think they've made a lot of improvements where you can look by, cancer type. You can look to find in particular locations. And I would say, to get some that you think may apply to you, and go and take those to your team, your healthcare, your oncology team, and see if you might be a candidate for any of those. I think it is very, very important that we, as women of color, men of color, really try to get involved in clinical trials. And I know, we all know what has happened in the past, but I choose to look at it as what happened in the past is the reason why we have so many regulations. There's so many rules now surrounding clinical trials that are very protective, so that we don't have to go back to the past.
Well
Indeed.
said.
Yes.
Absolutely. And with the genetic mutations or genetic variation with breast cancer, because more and more diverse women have been diagnosed and research has been done on the types of breast cancer they've had, we now have much more a greater understanding of the genetic variation that happens across populations, because people have agreed to allow their tissue to be entered
Right.
into the biobanks and really examined. So we've made strides, as Dr. Hampton said. So
I
we
think
also
also
thank those people that have done that.
I'll also make a comment. I mean, you can be in a clinical trial that's even easier than that. I mean, I'm enrolled in a clinical trial called the Wisdom Study, where all I have to do is get my mammogram that I need to get every year anyway. I go onto the site, I fill out a questionnaire, I upload my mammo results every year, answer questions. So, clinical trial doesn't always have to mean we're taking tissue or you giving you medication. So there are a lot of different ways that we can really be impactful and really help to get answers for our future generations.
Yeah.
Exactly.
I want to say there's an app on the iPhone too. When I find it, I'll drop it in the chat for folks. Sai, you kind of spoke to this, and I thought it was great about your running as your medicine. Any other advice for wellness for anyone who is a survivor or going through? Any other tips? That's for the whole panel.
I know for me, advocating for yourself as a patient is really important, because although this was my first time being diagnosed with cancer, it's not my first cancer scare. Back in 2019, I had a lump on my breast, and I went in, and this lump was something that I felt, it was palpable, like I could feel it. And so I went to my gynecologist because it had been there for a while. And I just said, I think we should check this out. And my gynecologist is also a Black woman. And she said, yeah, let's check this out. She was like, I think you're okay, but let's look at it. And I think she did an ultrasound, and then she sent me to a breast specialist. The breast specialist, I don't remember his name. It was an Italian last name. I wish I could remember. But he said to me, I think you and your gynecologist are overreacting. And it made me feel so small in that moment.
Yeah.
Because I felt like, well, should I not have brought this up to her? And he was just like, but I'll do it anyway. But I think you're fine. He was like, there's a 99.99.99% chance that it's benign. All I could think was, my aunt passed away from breast cancer. 2 of my other aunts have had breast cancer. Can you just do the thing that we asked you to do without,
Right.
belittling me or talking down to me like this? And it made me feel small, to the point that, the next year I think it was probably 2 years before I got a mammogram again, because I felt like I was. He ended up doing an aspiration of this. They were just cysts. They were benign. He ended up aspirating the couple of cysts that we had, and he did the biopsy and checked out, and told me everything was fine. But what he did tell me that he didn't know going in was that I had so many cysts in that breast that he couldn't count them all.
Wow.
I'm just cystic. But, we wouldn't have known that had my OBGYN not said, let's explore this. Let's find out what's going on. So I would say the first step to, taking care of your health is advocating for yourself, no matter what, even if your doctor doesn't have the best bedside manner. And, just make sure you step up and say, just look at it anyway, Doc. Like,
yes,
I know what's going on.
Yes, and good for you. And you bring up that advocacy part is so huge, and also the fact that you have a family history is additional fuel as to why you should have advocated as you did. And I just want to highlight that if you do have a family history, that's even more reason to be cautious and vigilant. So, Dr. Hampton, anything you want to add?
Just make a comment. It's okay to fire a doctor. If you find that doctor is not listening to you, it's okay to go and get a second opinion or get services from someone else. I think, as women, we follow prices in the grocery store. We're looking for that good pair of shoes. But when it comes to our health and our bodies, we really should be that discriminating and really that selective, because we've got one life to live. And so we want to be around providers who really care about that life as much as we do.
Well said. And in my book, Excuse Me, Doctor, I have a whole chapter on choosing your healthcare team. And I have a whole list of questions that you can use to interview your doctor. Because sometimes it might not be as obvious as the man making the doctor making the offhand remark like that. So kudos to you. And thank you, Dr. Hampton, for underscoring that point. We have time for one last.
I think you have the final word. Go ahead, Sai, quickly.
I just want to make one more point to your health. When it comes time for you to get some kind of treatment or whatever, and your village starts to step up and step in to help you, let them help you. That was a hard one for me to work through also, because I'm so used to just doing everything by myself. And my husband, stepped in and he was a rock for me. But then the whole village started stepping in when I went public with what I was going through. And once I allowed everybody to just help me, I'm so glad that I did, because it wasn't just about me. It was about my husband too, and helping our household, and helping, my family deal with it as well. So let your village help you when they offer to.
Amen. There's a saying, giving and receiving are one. And when you allow people to give to you, that enriches them, right? So who are you to take that chance away from them? Right. So thank you for sharing that. That was beautiful.
That's the final word, Dr. MEL.
All right. Well, thank you all. Thank you, Wayne and Lila, as always, bringing the incredible questions from the chat and the comments. Dr. Hampton, always just a fountain of knowledge. Thank you so much for all you do. Sai, honored and truly grateful that you shared your journey. Continued blessings on the way for good health and joy and wellness. Thanks, my Be Health Empowered family. We'll see you next week. And until then, be wise, be well, and be health empowered.